I was diagnosed with scoliosis at the age of 12 on a routine check in 6th grade where they had everyone bend over and look at their spines. At first, they monitored me for a couple of years, and then my curve seemed to be getting worse. It was around, I believe, 20 degrees, which was the threshold for when they put a back brace on you. My name is Jenya, and I'm a patient at PTSMC. I wore what they called a Boston brace for 2 years to prevent the curve from increasing. I was doing pretty well until I had a child in 1996. And then after pregnancy and birth, I started feeling really uneven. And the orthopedist found that the curve had actually increased, and it was around 40 degrees at that time. The prescription was to keep healthy and keep moving, and I tried to do that. But I always did feel I was uneven, and people occasionally would ask me, "Why are you limping?" And I would say, "I'm not limping." I tried to power through activities as best I could. Eventually, after years had gone by, I was looking for ways to improve the situation without surgery. So I really wanted to keep the flexibility in my spine and try to avoid having any surgical fusion. But no one really ever told me what it was that I could do on a day-to-day level to ensure that I could have as little pain as possible and as happy a life as possible. I had heard from various friends about a method of therapy that was called Schroth or Rigo, and people started telling me about breathing exercises or other exercises that could help with scoliosis, and that's what brought me to PTSMC. I would do a lot of things to compensate for my spine, but all the things I would do would be with my leg or they would be with my hip. I wasn't actually addressing anything with my spine, so the exercises when I came to PTSMC were actually on my spine to lengthen my spine and put space in the areas that were concave so I seemed to be straighter. In a typical session, the first thing we do is hang from a bar. It's an exercise called the semi-hang to stretch out your spine. It feels really good. Already when I first come in, I feel like there's just a lot more space and less compression. It's not aerobic work, but it feels like you're strengthening your muscles. And so then when I leave, I feel tired, but I also feel more stretched out. I was having chronic pain in my hip, occasional pain in my knee, and pain in my back that would wake me up at night. I told my therapist about those problems, and I asked if she could help me with them. What I didn't predict was that there were other things that she could also help me with. For example, when I first started the physical therapy exercises, I couldn't breathe as deeply as I can now. One of the first things that happened was that the expansion exercises increased my lung capacity, so I could actually draw a breath way more deeply. The pain in my hip and the pain in my knee did decrease significantly. It really exceeded my expectations. Physical therapy has really taught me a lot. It's taught me about my curve. I always knew that I had scoliosis and that I had an S-shaped curve. But what I didn't know was where that actually was on my body. So where was it that I needed to put breath or air to fill in the places that were curved? Another thing it's taught me is what I can do every day to stand straighter, walk straighter, move in a way that helps my curve. But because people are three-dimensional and not two-dimensional, it's kind of hard to figure out. So it took a lot of time to understand exactly how my curve was working in my body. But my physical therapist was amazing. She was so patient and never judgmental and really helped me understand over a period of time what I could do to improve my situation. I have to say that my physical therapist is just one of the clearest communicators I've ever found. She is so good at explaining what I should do that learning the hard exercises was actually not as daunting as I had feared. She's always positive. So if I come in and I say, oh gosh, I really don't feel like I did well this week, I don't feel like I understand, her response is, that's fine, we'll fix it. For people who have a lot of fear and anxiety about the way they look because of their scoliosis or the way they feel because of their scoliosis, and a lot of patterns to get over the way I do, having somebody whose demeanor is so calm and so reassuring and so positive is just amazing, and it contributes so much to the success of the exercises. I feel that physical therapy let me know what was possible, that things were not beyond my control, that there were things I can do every day to help improve my situation. I wasn't really looking for a miracle cure, and I don't feel that physical therapy was a miracle cure, but it's just the little things that add up to a better quality of life. So now if I feel pain, I have things that I can do that I know will help. One of the things I wanted to be able to do when I started physical therapy was to walk to work without pain. I live about a mile from my job, and I would be feeling like I was limping along. And now I have no trouble walking to work, which is really wonderful. Lots of people have told me that I look straighter. I'm actually looking forward to going to the orthopedist and finding out whether the curve is different. I can tell you that to me it looks and feels different. What would I say to someone who has scoliosis? It's never too late to get help. Why not try physical therapy? There's no downside as far as I can tell. I spent more than 20 years not doing anything about my scoliosis, and yet when I did seek help, I was able to see dramatic improvement.
If you'd like to learn more about scoliosis treatment, visit ptsmc.com.